Hello, my name is Nyla Hope, and during our PPI meeting on the 17th of July 2015, I took the opportunity to ask some questions, which although they fell outside of the scope of our meeting, I felt I needed to know were being addressed somewhere amongst the various projects and work streams. Joined up thinking, if you like, rather than just focusing on the quality of the measure, focusing more on the follow-up action to the potential response to that measure. The questions were welcomed and answered during the meeting, but I felt it worth logging the questions and responses because it's useful for all us PPI members to have some knowledge of the projects, protocols and procedures that work in tandem with the project that we ourselves are working on.
I am Fliss Mercer, Project Lead for Sea Change. We are working together to capture the main issues raised by our patient and family group and the way these refine and improve the Sea Change project. Nyla raises several important issues and I will respond after each one.
So I wanted to know, of the measures we're considering at the moment, we seem to have 15 pages of them, even though a lot of them are tick box responses. Could this be perceived as too daunting? And how will completing the questionnaire be supported in the real life environment?
Nyla and the group are right. At present, the study questionnaire is much too long, but up until now, we have been gathering the important questions and measures together to ensure we haven't missed anything which really matters for people with advanced illness and their families. Once we are confident we have done that, then we will work to cut down any duplication and focus on those areas that matter most. It is always a careful balance between wanting to ask everything and wanting to reduce the burden on those answering the questions.
How are we going to deal with the questionnaire in a multi-ethnic society where English is not always someone's first or predominant language?
We do not have the funds to provide interpreters or translations for all the questionnaires. However, we recognise the importance of trying to be as inclusive as we can. So first, we will encourage people to participate with the support of their family when appropriate. Second, we do have a wide range of languages spoken within the extended research team. Where we can, we will use this resource to support those for whom English is not their first language. Lastly, some of the measures are already available in different languages. We will have these available to use when needed.
How are we going to deal with responses that may show symptoms of emotional or mental anxiety which might fall outside the usual medical interventions? Will allied health professionals and complementary care be used?
This is a research project, so while we may uncover emotional or mental anxiety, we cannot directly provide support to address this. However, we do recognise how important it is to direct people to the best possible support if they are anxious or indeed have any other unmet concerns. And sometimes this needs to be done quickly. So we have developed what is called a distress protocol, a guide to all of us in the research team about what actions to take if we uncover anxiety or indeed other severe symptoms or problems which are not being addressed. The key to this is liaising closely with the person's permission with the clinical teams through whom we are recruiting. All of these clinical teams provide allied health professional support and some level of access to complementary care.
From the responses to the family and carer questionnaire, will there be a protocol in place that gently leads carers through what happens when death is close and making the shift from spending 24/7 making sure your loved one is well or comfortable, to being aware of the dying process?
Working with families to lead them through what to expect when death is close is beyond the remit of the research team. We do not have the resources or the training to do this, and it would be wrong of us to try. All of the people taking part in the study will be receiving support from a palliative care team, and as a research team, we do all have the training to recognise needs and to communicate well about them. We will signpost study participants to the support available through their own palliative care professionals when necessary.
What will follow from the responses to the family, religious and social needs questions, especially as the time of death approaches? I know from my case I was lucky in that the hospital recognised the need for a room for a large family to gather and pray with their dying loved one. The death certificate was issued quickly and my mother was buried the very next day after her death. On the flip side to that, after my mother had taken her last breath, despite logging in my mum's records that there were no vital signs, the nurse said that she could not confirm that death had occurred. A doctor had to do that. It took 4 hours for a doctor to come and confirm death. The hardest thing was when my father arrived and asked, "Is it true? Have the doctors confirmed it?" I was stuck in that I couldn't say that doctors had confirmed it, yet I didn't want Dad to hold on to false hope. So all I could say was, "She's gone, Dad."
We know that care around the time of death is so important. What is said or not said, and what is provided in terms of sensitive care and in terms of a rapid response, can be so important. The team was sad to hear of Nyla's experience and recognised how difficult this was for her. After reflecting on this, the research team decided to add in a questionnaire for families to complete about 3 months after the death. So for those families already taking part in the study, we will go on to ask them about the quality of the care they received, not just during the illness, but also around the time of death. In this way, they will be able to tell us, looking back, whether things were done well or not, and to help us understand better what needs to be improved at the time of death, as well as before.
If a carer completes the questionnaire outlining how their experience is and has been, how will they be supported in the run-up to and after the death of their loved one? This is an issue which is very important and illustrated very well by Victoria, a fellow member of the Sea Change PPI team, which I will share in another video. Thank you to Fliss for answering all my questions and putting us all in the picture as to what developments are occurring within other work streams and associated projects. Thank you.